Dear viewers, in continuation, this is my another video. I will be talking on extrinsic autoregulation of heart. Intrinsic, if you have gone through this video, intrinsic autoregulation, I have talked about how the inner system of the heart is involved in intrinsic autoregulation. Now my aim is to tell you about extrinsic autoregulation. Extrinsic means, look at this diagram, heart is there and this heart is controlled by the autonomic nervous system. So here if we talk about the medulla, this is medulla. We have nucleus tractus solitarius, that is the sensory area. So here we have the receptors and then we have the afferent, and this afferent is carrying the information about the pressure. Now about the pressure, we have the carotid bodies, we have the carotid sinus, we have the aortic sinus. So here the information about the pressure will be carried by the afferent present in the vagus, and then efferent. From the efferent we have the center in the medulla, that is cardio-inhibitory center. From that we have the efferent. So this is the vagus, 10th cranial nerve, vagus. This is efferent and this is afferent. And then we have the parasympathetic, we have the sympathetic also. And the center of sympathetic is present in the lateral horn of spinal cord. So here this is the preganglionic neuron and this is the postganglionic neuron. So this is about the sympathetic. The nerve ending of parasympathetic secretes acetylcholine and the nerve ending of sympathetic secretes adrenaline. From this ending, the adrenaline is secreted. Now practically speaking, what is the meaning of extrinsic autoregulation? Extrinsic autoregulation. Extrinsic autoregulation means, as for example, if we give an example, sometimes our heart rate is increased, sometimes our heart rate is decreased. If we hear some bad news, bad information, then suddenly we'll be afraid and our heart rate will be gone high. Sometimes we are relaxing, we are sleeping, our heart rate will come down. So this increase with the heart rate or decrease with the heart rate, this changes actually comes from the extrinsic autoregulation. Means when in this regulation we will be talking about how the heart is influenced by the autonomic nervous system, is influenced by the sympathetic, is influenced by the parasympathetic. If you remember, in intrinsic autoregulation, I talked about the SA nodal fibers or the pacemaker fibers. We have the gap junction. This is the gap junction, and then we have the cells, that is contractile cell, and we have gap junction here also. This is the gap junction. So this is contractile cell, and this is pacemaker fibers. As soon as there is any changes in the pacemaker fibers, means what changes? There is a generation of electrical event, action potential. So this action potential, if we generate it here, this will be traveled to this cell. This is cell number 1, this is cell number 2, and this is cell number 3. And then because of this gap junction, all these contractile cells also will be stimulated. So what I am telling is, I am telling about intrinsic autoregulation. Intrinsic autoregulation means there in this regulation also there is involvement of pacemaker fibers. This is the essay note, pacemaker fibers, and then we have the contractile cell. Pacemaker fiber is supposed to generate the electrical activity of the heart. Electric action potential is generated, and this action potential ultimately will go to all contractile cell, and there is a contraction followed by relaxation. That is the intrinsic autoregulation. That is not influenced by sympathetic and parasympathetic. But in extrinsic autoregulation, completely it is influenced by both parasympathetic and sympathetic, as we can see from this diagram. Here I have drawn the heart. I have drawn the diagram of the heart, how it is controlled by the vagus as well as the sympathetic. Sympathetic, from the nerve ending, adrenaline is secreted, heart rate will be increased. Here from the nerve ending, acetylcholine is secreted, heart rate will be reduced. So once heart rate is reduced, blood pressure also will be reduced. Once heart rate is increased, blood pressure also will be increased. So this comes under extrinsic autoregulation. Now coming to the actual mechanism, how it happens, extrinsic autoregulation. So here I have drawn the two cells. One is nodal cell, another is contractile cell. We have the gap junction. As already I have mentioned here, whatever the changes here, this is a nodal cell, and this nodal cell comes under specialized conducting tissues of the heart, and this cell can generate impulse by its own. Here we have, if you remember, I talked about the intrinsic autoregulation, where I have said funny sodium channel. So here the resting membrane potential is minus 60 millivolt. So there is a funny sodium channel, and this funny sodium channel is there. There will be an entry of sodium ion, positive ions. Now this potential minus 60 millivolt will be changed to minus 55 millivolt. Now this minus 55 millivolt will help to stimulate the voltage gated calcium channel. So we have the two type of voltage gated calcium channel. One is T channel, that is the slow channel. Another is N channel, that is the fast channel. So first there will be a stimulation of slow voltage gated calcium channel. So this minus 55 millivolt will be changed to minus 40 millivolt, that is the threshold potential. This threshold potential, as soon as the potential is brought at threshold level minus 40 millivolt, then there will be a stimulation of voltage gated L type calcium channel. So suddenly there will be a change with the potential, and that is up to plus 40 millivolt. This is because of L type calcium channel, and this is because of T type calcium channel, and here this is because of funny sodium channel. So this minus 60 millivolt is first, it is due to an involvement of funny sodium channel. This will be minus 55 millivolt. Again this minus 55 millivolt will initiate the activity of T type calcium channel, and the potential will be changed to minus 40 millivolt. That is the threshold potential. Once threshold potential is there, then automatically there will be a stimulation of L type calcium channel, and the potential will be changed to up to plus 40 millivolt. Then this channel will be closed, and there will be a repolarization. Repolarization means again the potential will be minus 60 millivolt. Again minus 60 millivolt, this is the repolarization. Again there will be a stimulation of funny sodium channel. So the same type of activity will be there. Depolarization, repolarization, depolarization, repolarization. That is the intrinsic. These changes, depolarization, repolarization, also we can see in contractile cell. Now this depolarization, repolarization will be influenced by the sympathetic as well as the parasympathetic. So we have the receptors here. We have the receptors for sympathetic, for adrenaline. So here the sympathetic, as soon as there is a stimulation of the sympathetic, there is a secretion of adrenaline here from the nerve. So adrenaline is secreted from this, and now this adrenaline, what will happen? This receptor which will stimulate G protein, stimulatory protein, G protein will be stimulated, and this protein what will it will do is this G protein as soon as the G protein GTP will be converted to GDP. GTP will be converted to GDP, and then what will happen? We have the adenyl cyclase. Here we have membrane will have adenyl cyclase. So this GDP, this stimulatory protein will stimulate adenyl cyclase, and there is a stimulation, there is a formation of cyclic AMP. ATP will be converted to cyclic AMP, and this cyclic AMP will stimulate protein kinase. This protein kinase A will be stimulated here, and this enzyme will be stimulated here, and this enzyme will stimulate calcium channel. Again I will repeat, this receptor adrenaline, what it will do? It will stimulate stimulatory protein, G protein, stimulatory part of G protein, and this will convert GTP to GDP. So GDP will be formed, and then due to this there will be a stimulation of adenyl cyclase. This adenyl cyclase actually will convert ATP to cyclic AMP. The cyclic AMP will stimulate the protein kinase A, and this enzyme ultimately stimulate calcium channel. So the calcium channel means there will be an huge entry of calcium ion here. Now again, why we are talking about calcium channel? Here also the contractile cell, we have the calcium channel, we have the entry of calcium channel. So whatever happening here, the same thing also here, minus 90 millivolt. This minus 9 millivolt will be changed to minus 70 millivolt because of the entry of sodium ion here. This is the threshold potential. This is the threshold potential. Now there is an involvement of sodium, voltage gated sodium channel, So this will be plus 40 millivolt, and this plus 40 millivolt, again if we look at, this will help to stimulate both voltage gated calcium channel as well as there will be an exit of potassium ion. So if we look at the graph, the action potential graph, here we have the plateau phase. This plateau phase is because of entry of calcium ion. What is the need of calcium ion? This calcium ion actually is very much essential to form actomyosin complex. Without calcium ion, there will be no formation of actomyosin complex. Means what I am talking about, we are expecting the contraction of contractile cell. So this contraction will be there if there is an entry of calcium ion. So what sympathetic is doing is, this sympathetic ultimately will activate the calcium channel. So there will be more entry of calcium ion. So there will be more formation of cross bridges. So there will be a powerful contraction. So what is the function of sympathetic? If we inject adrenaline or if we stimulate sympathetic, then what we can see is we can see the powerful contraction. Both rate will be increased as well as force also will be increased. So this rate as well as force of contraction and heart rate also will be increased. So that both effect comes from the stimulation of sympathetic adrenaline. This adrenaline actually, this will help in stimulating the calcium channel, and due to that there will be a powerful contraction, and once there is a contraction, there will be a relaxation. So this protein kinase actually stimulate the voltage gated calcium channel, and that is the effect of sympathetic. This receptor also is present here. So receptors adrenaline is there, and the same mechanism here, there is stimulation of G protein, and this G protein will stimulate adenyl cyclase, and this adenyl cyclase will form the cyclic AMP. This cyclic AMP actually will stimulate protein kinase. So what I want to say is that both nodal cell and contractile cell are controlled by the sympathetic, but in case of parasympathetic, the receptor we will find here, the parasympathetic receptors for parasympathetic acetylcholine. Parasympathetic, this is the acetylcholine will be secreted from the nerve ending, and then this receptor will stimulate the receptor. Then receptors will have three subunit. One is alpha, another beta, another is gamma. Alpha, beta, gamma, three subunits are there. And what is the function of this beta and gamma unit? Beta and gamma. Here we have the potassium channel. We have the voltage gated potassium channel. So this beta and gamma, remember, this beta and gamma will stimulate exit of potassium ion, will stimulate, and this alpha subunit will inhibit protein kinase. Again, I will remember what is the function of parasympathetic. Parasympathetic receptors for parasympathetic will never find in contractile cell. Will never find. इसमें नहीं है. Contractile cell में receptors for parasympathetic नहीं होता है. Receptors for parasympathetic only present in nodal cell. Specialized conducting tissue जो SA node है, AV node है, उसमें हमें रिसेप्टर मिलेगा पैरासिम्पैथेटिक. पैरासिम्पैथेटिक नर्व एंडिंग से कौन सा न्यूरोट्रांसमीटर सीक्रेट होती है? एसिटाइलकोलाइन. In these receptors we will have three subunit, one alpha, beta and gamma. The function of beta and gamma is to stimulate the voltage gated potassium channel. Here also we will have potassium channel. Here also we will have potassium channel. So there will be an rapid exit of potassium ion. So repolarization also will be there, and then inhibition is there. Repolarization is there, and inhibition in the sense the protein kinase A is inhibited here. This protein kinase A is inhibited there. So there will be a less entry of calcium ion. So what is the function of parasympathetic? Parasympathetic actually will inhibit the heart. So if we inhibit protein kinase, so there will be a less entry of calcium ion. Once there is a less entry of calcium ion, so there will be less formation of actomyosin complex. So there will be no contraction. Again, if there is an exit of potassium ion, hyperpolarization is there. So ultimately, the cell will not participate in contraction. Once contraction is not there, relaxation also will not be there. So the function of parasympathetic is inhibitory. And the function of sympathetic is stimulatory. How? This sympathetic will stimulate the protein kinase, and this protein kinase actually will stimulate the voltage gated calcium channel. So there will be more and more entry of calcium ion. So there will be powerful contraction, and rate also will be increased. And here the parasympathetic, if we talk about this parasympathetic acetylcholine, will have the receptors, and these receptors will have three parts: alpha, beta, gamma. Beta, gamma will have a role on potassium channel. Potassium channel will be stimulated, so there will be more exit of potassium ion, so hyperpolarization will be there. And here in this case, the alpha subunit will inhibit the protein kinase. So here I will draw a diagram. Please follow. So what I am drawing here, I am drawing the y-axis and x-axis. So here I am drawing the action potential or electrical event recorded in pacemaker fibers. electrical event recorded. What is the resting membrane potential? Minus 60 millivolt. Then what is the threshold potential? Threshold potential is minus 40 millivolt. Minus 40 millivolt, that is the threshold potential. That is the threshold potential. Now, if we draw the diagram of action potential, what I am drawing? I have drawn the action potential recorded in pacemaker fiber. This is plus 40 millivolt. This is the millivolt, and this is the time. Here it is 100, 200, 300, 400, 500, 600, 700, 800, 900, 1000, 1000, 1100, 1000, 200, 1300. That is the millisecond I am talking about. So this side time, and that is given in millisecond, and this side it is the millivolt, and this is the line. You can say this is the action potential I have drawn. Here this is the depolarization, and this is repolarization. This is depolarization, and this is repolarization. This is repolarization, 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 and this is depolarization and depolarization. Total duration near about 250 to 300 milliseconds. This is the action potential recorded in pacemaker fibers. Now this is the normally we can find, जिसका हार्ट रेट जो है 75-80 है, उसमें हमें नॉर्मली जो एक्टिविटी पेसमेकर फाइबर में मिलेगा वो देखने में यही है. इसमें डिपोलराइजेशन होता है, रिपोलराइजेशन होता है. टोटल ड्यूरेशन 250 से 300 मिलीसेकेंड होती है. इसमें कोई प्लेटिव फेज होती नहीं है, ये कॉन्ट्रैक्टाइल फाइबर नहीं है. दिस इज द पेसमेकर फाइबर. नाउ इफ वी स्टिमुलेट सिंपैथेटिक, then what type of graph we will have? If we stimulate the sympathetic, then this will be changed. If we stimulate the sympathetic, then the resting membrane potential may be minus 55 millivolt. This will be more positive if we stimulate the sympathetic, and the rate here, this is the resting membrane potential. This is the action potential we can record in the resting condition, and from this we will have one bit, from this we will have another bit, from this we will have third bit. Here number of action potential is increased here. This is 1, 2, 3, 4, 5, 6, 7, 8. And normally कितना होती है? Normally 1, then 2, then 3, then 4. So normally there are 4 action potential. But if we stimulate sympathetic, we have 8 action potential. So that is the effect of sympathetic. Rate increases. Rate is increased. 8 action potential means 8 heartbeats will be there. But normally 1, 2, 3, 4. 4 action potential there when there is no involvement of sympathetic or the parasympathetic. Now in case of parasympathetic, if we stimulate the parasympathetic, then what will happen? If we stimulate the parasympathetic, then what will happen? Look at this graph. If we stimulate the parasympathetic, then this is the action potential. The resting membrane potential may be minus 65 millivolt. Here this will be more negative. This will be hyperpolarized. The resting membrane potential, if we stimulate the parasympathetic, the resting membrane potential will be changed. This will be more negative. This will be hyperpolarized. Once it is hyperpolarized, then the number of action potential will be reduced. Number of action potential, here normally how many? 4 action potential we have got. If we stimulate the sympathetic, instead of 4, 8. If we stimulate parasympathetic, only 1 action potential we can record. That is the depolarization, and this is the repolarization. I am repeating again. I am showing you a graph where the number of action potential is altered whenever there is a stimulation of either sympathetic or parasympathetic. In case of sympathetic, number of action potential will be increased. In case of parasympathetic, number of action potential will be reduced. Practically also you can do it. If you have frog in the laboratory, you can stimulate the vagus. Easily we can stimulate the vagus, and really you can see practically if you can stimulate the vagus, the heart rate will be reduced. Even heart can be stopped. Heart can be stopped. How we can talk about, if we draw the conclusion, then it is that if we stimulate the parasympathetic, from the nerve ending there is a secretion of acetylcholine, and this acetylcholine will inhibit protein kinase C. Protein kinase enzyme is inhibited, and this protein kinase actually will inhibit the calcium channel, voltage gated calcium channel. So there will be no contraction. The rate is reduced. From this also we can say that number of beats reduced whenever there is a stimulation of parasympathetic. But the opposite scenario we can have if we stimulate the sympathetic. Thank you. This is the extrinsic autoregulation of heart.